Good morning, everybody, and welcome to AM Buffalo. Listen, did you know that for more than 60 million Americans enrolled in Medicare, costs concerning their health care is still one of the biggest stressors? Well, almost half of that number find that they're still spending more on health care than they planned. Well, Elena McFan is the Central Region CEO of United Healthcare, Medicare, and Retirement, and she joins us live via satellite with info on making good decisions and debunking some of the myths. So good morning, Elena. Let's start with a basic. At age 65, Medicare covers all of your health care costs. True or false?
Oh, Linda, that's false. It does cover your health care, but not all your costs. For example, it only covers 80% of your physician visits and your outpatient costs. So if you go to the doctor's office and have a lab and an x-ray, and if the bill itself is $1,500, you will be on the hook for $300, and there's no cap to that. And if you become very seriously ill and have to be hospitalized for a long period of time, you may be out thousands of dollars from your pocket, again, with no cap.
All right, true or false? Choose the lowest premium to save money.
We actually encourage that people look beyond the premium. Don't just stop with the lowest premium. Look beyond the premium to look at out-of-pocket costs for visiting a physician or for hospitalization, and then look even further beyond that. What other benefits are included in the plan? Does it include transportation to the physician's office? Does it include a gym membership for free? Or does it even allow you the opportunity to have a nurse practitioner come to your home once a year and do a head-to-toe health assessment?
Okay, Elena, Medicare covers vision, dental, and hearing just like your employer-sponsored plan through work. True or false?
Oh, that's false. So Medicare, original Medicare does not include coverage for comprehensive dental or comprehensive vision or even hearing aids. Medicare Advantage plans in many cases do. So it's not unusual for us to speak to a senior who has spent thousands of dollars out of their own pocket for hearing aids when they may have had an option otherwise under a Medicare Advantage plan to get those hearing aids at a reduced rate.
Okay, now how about this one? There's no need to sign up for Part D prescription drug coverage if you're not currently taking drugs. True or false?
Oh, false. Please do make sure when you're turning 65 that you are looking very carefully at your prescription drug coverage options or Part D. 90% of all people over 65 are on at least one medication. Second, if you don't choose a Part D coverage or prescription coverage option when you turn 65, later on, if you decide to change health coverage options and go with a Medicare Advantage plan, you will incur a penalty for not having selected a Part D plan, and that penalty will travel with you for the rest of your life.
Well,
so
hopefully
you can choose So go ahead.
I was going to say thank you, Elena, for your information, because having all those truths and those facts will keep people from stressing out over it. The more knowledge you have, the better you're going to do. We want to thank Elena McFan and United Healthcare. If you'd like more information about what Elena's talking about, newsroom.uhs.com/Medicare myths. Okay, all of those things we talked about were myths.